Today's Sunny 95. Feel good.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. This is episode number 587. Today, we're going to welcome inventor of the pinhole technique for gum grafting, Dr. John Chao. Before we get started, though, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko, and if you would please go to my office Facebook page and like us, that would be awesome. Also, all past episodes complete with videos are available at thereasonswesmile.com, and we're streaming live on Facebook. In about 10 minutes, we're going to be giving away free flowers from the Santa's Florist. All you have to do is listen a little bit, try to make the question simple, so that if you've been listening at all, you're going to get the right answer. And so let me tell you a little bit about Dr. Chao. He is a research associate professor at the University of Buffalo, adjunct assistant professor, Ostro School of Dentistry, USC. Dr. Chao's involvement with the postgraduate periodontics program at the University of Buffalo, SUNY, speaks to the depth of his knowledge and experience in the scientific investigation of gum disease. As a research assistant professor at this university, Dr. Chao is involved in a major study comparing the pinhole surgical technique, which is his invention, to the standard treatment for gum recession called the connective tissue graft. Dr. Chao will be one of the authors of this new study. The main reason Dr. Chao has served as faculty at the USC School of Dentistry is that he believes the best way to learn more is to teach. So, we have with us on the phone from California, right, Dr. Chao?
Yes, Los Angeles, California.
From Los Angeles, California, Dr. John Chao. He's the inventor of the Chao pinhole surgical technique, also known as PST. He's invented it, he's patented it, and he teaches other dentists how to do it. So we want to talk about that today. First of all, Dr. Chao, I think this is really cool. How did this pinhole technique come to be? In fact, you call it gum rejuvenation, not a technique, right?
Well, it is a technique. We call it gum rejuvenation because it sounds friendlier.
Okay.
The name is pinhole surgical technique. This came about when I was not having good luck in getting it done the regular way, which is if you have receding gums that need to be treated, you would take a piece of gum from the roof of the mouth, and then you put it over the tooth that you want to graft, and then you suture it together. Well, I was able to get relatively good results, but when you graft the tissue from the roof of the mouth, it leaves quite a scarring, unpleasant experience with the patient. Sometimes you bleed, but most of the time it is quite sore.
Okay. You know, I haven't found that to be true in my instances and when I do the surgery, but maybe I'm just managing the palatal tissue a little differently. But anyway, yeah, we'll talk more about that. So, go ahead.
So, and eventually I decided that, maybe there's another way where we don't have to graft and still get very good results.
Okay.
So that started me on the odyssey to find out how to do it another way.
Awesome. Now, Dr. Chao, are you a general dentist like me or a periodontist?
I'm a general dentist.
Awesome.
I'm just like you.
Yeah, I love hearing that because we general dentists are pretty inventive, aren't we?
Yes, we run into different things, and us dentists, we're made that way. We're made to be solving problems. That's what we do all day long.
Right.
And that's the fun of it.
Exactly. So I love doing grafting, and I was very interested to hear about your technique, about how it can be done, and the way you write it. And folks, I'm sorry about my voice. I'm kind of losing it, but I'm still good. So you call it pain-free, scalpel-free, suture-free, and graft-free. That's pretty cool. So tell me about that.
Yeah, I can't. You can. For most part, my patients have very little pain to deal with. Maybe they take a Tylenol with an Advil, maybe 2-3 sets, and that's it. But I would not just come out and say it's a pain-free, because pain is so subjective.
Right.
So we say maybe virtually pain-free, minimally invasive.
Okay.
We don't have a pain problem at all.
Okay. You do have to numb people, right?
Yes, they do need to be numbed up with the local anesthetics and Novocaine, and it's just like getting filling done, getting your teeth cleaned. We do use local anesthetics.
Okay.
And that I never had to do anything else besides that.
Okay. Well, that's really neat. Now, did this evolve over time, or was there an aha moment when you said, "Oh my goodness, I can do it this way"?
I think I have there are moments when I feel like, gee, this is a quantum jump. But I think that I can probably trace it back to one incident that was followed by other aha moments. The number one incident must be about the year 2000, maybe a year before that.
Okay.
I remember that I was trying to fix a receding gum problem for a patient of mine, Brother John.
Okay.
He had recession over his right eye tooth.
Oh, okay, right up front.
So very carefully, I took a piece of tissue from the roof of the mouth, and I had the area prepped already. I made the incisions over the eye tooth already, and I was ready to put the specimen on the tooth, and which I did. I turned around to pick up the suturing instrument called the hemostat with a needle on it. I was ready to suture the specimen from the roof of the mouth, and I couldn't find it. It was gone. And my assistant Joy pointed at the suction tip.
Oh, my. Oh, she sucked it up.
Grain, I can remember kind of a sucking noise.
Oh, boy. That's not the sound we want to hear when we're doing grafting, is it?
No tissue now.
Oh, boy.
I couldn't very well go back and cut another piece of tissue off without having to explain this embarrassing circumstance.
Right.
And so, after a moment of sweating, I remember that there was a supply of donor tissue, tissue that's come from a tissue bank that's given by human beings, and so
Alloderm?
I happened to have a piece there.
Yeah, I keep that in stock as well. It's called Alloderm.
I used that piece and finished the operation.
Okay.
It was okay. It turned out okay. He still comes back, every 3 months, and it was not a bad job. It was a decent job, but he would never let me touch him again. Even though I had a pinhole technique, that was not pleasant for him, I guess, because of the situation with the roof of the mouth.
Okay.
So then we debated between Joy and I, but Joy insisted that it was I who suctioned up the specimen and not her. So we couldn't figure out who is the originator of this whole sequence of events that ended up with 3,000 dentists all around the world doing pinhole.
Oh, wow.
Anyway, if there was a seminal moment, that was probably it that started it all. And after that, I'd say, you know what, there's got to be a better way where it doesn't require us to cut from a palate.
Right.
Then I began to experiment, and with success. I don't experiment on patients, but I just realized that coming from the let's say on the upper tooth, coming from the loose tissue above the teeth may be a good idea, and there were registered methods using that technique. So I used and adopted kind of an altered version of that, and I found that if I used those methods, I was getting not only better results, but of course less pain.
Right.
And as I make the incisions to cut smaller and smaller, I was getting better and better results.
So smaller and smaller incisions were getting you better results, probably from less trauma.
When I got into a pinhole size, I realized I got a problem. I couldn't find any instrument that was made for going through a hole and releasing the tissue from the bone and from the root.
Oh.
Then for the next 7 years, I worked on inventing new instruments that would allow me to do everything from a pinhole.
Oh, wow. So for 7 years you worked on inventing the instruments that would allow you to go through a pinhole. Okay.
So by 2006, I had the instrument of the method down pretty much, and so at that point in time, I begin to accumulate data for publication. In the meantime, I also decided to trademark it and patent the intellectual property so that I can control the teaching of the method in a way that I feel would be up to standard.
Right. No, very smart of you.
Yeah. So by about 2013, then everything was in order, and the method was published in a peer-reviewed journal, and the patents were approved by the U.S. Patent Office. So I began to teach in 2013. So that's the journey of Pinhole's technique from beginning to end.
So, Dr. Chao, we always do a Dr. Kvitko's question of the day each week, and so what we're going to do that now. But I just want to remind people that the benefits of the Chao Pinhole surgical technique, PST, there are benefits that you can do the whole mouth at one time. Recovery-wise, it's much quicker for recovery, less downtime, and there's less pain and swelling, correct?
Yes.
Okay.
Less pain and swelling.
So people need to remember that if they want to plan on winning those flowers from DeSantis Florist. What?
And it looks good instantly.
Oh, instantly.
Over there, you smile, and it looks like the gums have magically reappeared down where they belong. So this is the dramatic part that makes it so much fun for the dentist who know how to do this kind of procedure.
Okay, yeah, no, that's really cool. Hey, Dr. Chao, let me just interrupt you for a second. We have to go to a break here in a minute. Can you hang with me?
Oh, of course.
Okay, awesome. All right. Okay, so I'm going to recap because we are about to do Dr. Kvitko's question of the day. The benefits of Dr. Chao's pinhole technique are that you can do the whole mouth at once. There is a quicker recovery than the traditional method. There is less pain and swelling involved. There is less downtime. And it looks good instantly. All right? Remember that, because in a minute we are going to do Dr. Kvitko's question of the day. But before we do, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, which of the following is true about the pinhole technique? For those of you just joining us, we're talking with the inventor of the pinhole technique for gum grafting, Dr. John Chao. Is it A, you can treat the whole mouth at one time? B, the recovery is quicker with less pain and swelling? C, it looks good instantly? Or D, all of the above? All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of The Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. We're doing Dr. Kvitko's question of the day. We don't yet have a winner, so if you want to call 614-459-9769, you'll have a chance to win free flowers from DeSantis. We're going to leave the phone lines open The question was, which of the following is true about the pinhole technique surgery? A, you can treat the whole mouth at one time. B, the recovery is quicker with less pain and swelling. C, it looks good instantly. Or D, all of the above. That sounds like a good answer to me. Anyway, okay, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile, episode 587, and today we're talking with Dr. John Chao, the inventor of the pinhole technique for gum grafting. Dr. Chao, how many dentists have you trained so far?
So far, we've trained over 3,200 dentists.
Wow.
From around the world. About over 800 are periodontists. The rest are general practitioners like you and me. So it's a good technique for anybody, no matter what your background is.
Okay. 3,200 around the world, 800 of which were periodontists.
Yes.
Okay. Now, so why do you feel the pinhole technique is a better way of doing gum grafting? You mentioned less pain, but what else?
Yes. It's a better way, alternative way for a lot of patients to consider because, number one, when you don't have to cut from the roof of the mouth, it relieves a lot of the complaints that the patient have about getting this kind of procedure done.
Right.
So, and also we don't have to use scalpels or sutures. We don't have to cut or stitch because everything is done through a pinhole, like arthroscopy. So when you do knee surgery, you put a little tiny hole there, you do everything with the scope, and then it's done and it heals really fast. Well, it's the same concept with pinhole.
Wow.
It's done through the pinholes, and then so we don't have to use any cutting instruments, nor do we have to do any stitching because we're not cutting. So that saves a lot of symptoms such as pain, bleeding, and swelling. So because it is minimally invasive. So symptom-wise, recovery-wise, downtime-wise, it's just really is made for the patient who doesn't want to put up with any of that. So in that sense, the pinhole has some unique benefits to it compared to the gold standard, which is excellent. It's held up over time, and it's got good results. But the symptoms are such a problem for patients. Now, the other major advantage, which is acknowledged by the organization that represents all the periodontists, the American Academy of Periodontology, is that you can only harvest so much tissue from the roof of the mouth.
Right.
And so you cannot, let's say, do more than 3 or 4 teeth at a time.
Right.
We know people who are around 50s and 60s, they get multiple sites. They don't have just one area where they have receding gums. They have 3, 4, 5, 6, 10, 12 areas on the upper jaw and the lower jaw that needs to be done all at the same time. So now these folks, if you use the traditional grafting method from the palate, from the roof of the mouth, then you have to do three times, which means you have to cut the palate 3 times and then wait 3 to 6 months and then do another part and do another part. So with pinhole, it is acknowledged that for multiple sites, pinhole does have a unique advantage over the traditional method of doing grafting from the palate.
Okay.
I do, to be fair, there is another method, they're called the tunnel method,
right,
where you can do multiple sites all at one time. But that method calls for you to use basically donor tissue.
Okay.
It's from cadavers,
right,
donated by human beings. So
yeah, I think we spoke about that a little bit earlier. It's called alloderm.
So if you have objections to using that, then it becomes a problem for some of the patients who just don't want to use that. Because what we use is a pig or cow-derived collagen, which disappears completely.
And just like me, Dr. Chao, I understand that you get your collagen from a company called Geistlich Biomaterials. I buy my products from the same company. It's a good company.
So if you use pinhole, we use collagen and we don't use anything else, and which becomes less objectionable to patients. So the main advantage, to answer your question, is that we can do the whole thing in one session, the whole upper arch, the whole lower arch, and we can do the whole mouth all at one time. It requires four visits back, and then we're all done with the entire mouth. So we can do as many as the patients who want done, and it takes a very short time to do all of that.
Wow. Okay, so hey folks, if you're just joining us, I'm Dr. Kvitko. We have Dr. John Chao. He is the inventor of the Chao pinhole surgical technique known as PST. It's a new cool way to get the gum grafting that you need, where you see some of the side of the tooth, the root is exposed, and have it corrected with all of the areas done in one sitting, with less pain, with faster healing, less swelling, right, Dr. Chao?
Yeah,
pretty much.
Little swelling, fast healing, and hardly ever any downtime. In other words, you can go to work the next day if you want to. You might have a little bit of swelling, but if you look in the mouth, Dr. Kvitko, when you look in the mouth, after you have pinhole done,
yes,
you can hardly see that you'd had surgery done, except now whatever was a long root, now it's covered up to where it's normal. So
yeah.
Patients really like it because it's quick, it's easy, and it's instantly pleasing. That's the part that's very dramatic for patients, and they often have to just really moving comments to make because they're so gratified by the instant change. Within an hour or so, you have a smile with long roots, and then now when you smile when you leave, and the gum line is down to the normal level. So
yeah,
a lot of fun doing this. Patients are really, really happy having this kind of procedure done.
Yeah, I love doing the procedure. I haven't been trained to do yours yet, but I plan to. So, Dr. Chao.
I hope that you can come.
Yeah, I was on the website earlier, so I'm gonna check and see when the next one is, and try to plan it into my day or my life.
Yes, I would love for you to be able to do it, and to be able to tell your vast audience and those who follow you how you like it, how you compare the grafting to the pinhole, and where you can use it to great advantage.
Right. No, it sounds cool. Hey, Dr. Chao, looks like it's time for a commercial break again. Sorry about that. I'm so interested in your topic. But can you hang on just a little bit longer, because we have a little bit more time?
Yes, we'll continue after the break.
Oh, good. Okay, didn't want to lose you now. I don't want you hanging up on me, because I'm so interested in your topic. All right, actually, I understand we have a winner of today's Dr. Kvitko's question of the day, those flowers from DeSantis. Let me ask my producer, who is that winner?
Dr. Kvitko, the winner of the free flowers today is Mindy from Grove City.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
If you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile, episode number 587, and today we're talking with the inventor of the pinhole technique for gum grafting, Dr. John Chao. So, Dr. Chao, are there any drawbacks to this technique?
Well, there's drawback to every procedure, but it doesn't have any more drawbacks than any other procedure. You do have to put up with the fact that the gums are being worked on. Now the gums are thicker than before. We want the gums to be thick. We kind of overcorrected, so you feel a little bumpiness, like a little something that's behind your lip, like a little cotton ball.
Mm-hmm.
So you do have to put up with that for a few weeks until it normalizes, because we do want the gums to be thicker to begin with, so that when it heals, you'll regain its normal thickness and size.
Right.
So that's one thing you have to put up with. The rest of it is just like it's pretty normal. I can't think of any downside to it.
I want to get into some specifics. So, for example, since you know I also do grafting, and I want to try to make sure my audience understands, but it's not always, we don't always graft just because there's root showing. Sometimes we graft because there's not enough attached gingiva or that connective tissue that attaches. So if you're not grafting tissue and you have no attachment, does the collagen take over and take that role?
The tissue actually truly attaches to the root. So it's not like you have recession and then the gums grow over the root, but there's a space between the gum and the root. That is not what's happening. What's happening is that after we move the gum down the root, we put collagen between the gum and the root.
Yes.
That collagen over time totally dissolves, and it leaves the root attached to the
gum.
Leaves the gums attached to the root, and when you push it with a periodontal probe or a gum probe, you cannot go through it. It's truly attached as if it was never separated.
Okay. So then you can
just like what you do when you graft, and once you grafted it, and you have attached tissue there, and so you cannot push it through, and so by the same token, the gum reattaches to the root, just as if you grafted it.
Oh, that's really neat. So you can take a tooth that has no attached gingiva and correct it this way without actually taking tissue from another part.
Exactly, Dr. Kvitko. We don't need thick tissue. We don't need attached tissue. You know what a class 2 is, where the tissue is not attached.
Right.
And when we get done, two things happen. We get the roots covered, and the tissue actually gets thicker.
Wow.
Attached and it's thicker than it was before. This is why I alluded to the fact that our technique calls for us to overcorrect the problem, make it a little thicker than it's meant to be, because then we can account for the shrinkage of the gums to the size and the level it should be.
Right.
And so we have a natural looking gum.
Mm-hmm. No, that sounds cool.
Yeah, also, Dr. Kvitko, I do want to tell you that you know how it is when you graft tissue from the palate?
Yes.
Put it where it belongs, but the tissues sometimes don't look natural. Have you encountered that, Dr. Kvitko?
You know, not really, because even the ones that I was doing way back when I first started this particular type of grafting, I did it slowly, and I made sure that the results were awesome, and you can't even tell that this was surgery. I mean, of course, I've also had it happen where I had a little bit too much tissue, and it was a little bit lumpy at first, but over time it thinned out and looked great. But I have seen photos, and I've been at study clubs where people were presenting, and I saw some grafting procedures that just didn't look right. You know, I'm looking at that going, well, I could have done better than that. And I think it's because I've taken the extra time, you know, to slow down, do it right, be careful, and make sure that it looks natural. But I do know what you're talking about. Believe me, I do know what you're talking about. So
yes, I've seen a lot of plastic gum surgeons, periodontal surgeons. They do a beautiful job. But in my hands, it never quite looked right. But with the pinhole, because we're using tissue that's right there anyway, we never have a tissue meshing problem.
Wow.
It always looks nice.
That's really cool. Now, you can do an entire arch at one time, so you can do 16 teeth if you wanted to.
Yes.
Okay. And so, this is so cool.
I could do 30 teeth.
I'm thinking you meant to say 32 teeth, right? Because there are 32 teeth.
Exactly. Upper and lower. Because patients prefer that.
They want it all done at once if possible, and I can't blame them. I would want it all done at once also. I mean, why not? Why have 2 or 3 surgeries when you can have it all done in one? Anyway, Dr. Chao, you've been so gracious. Thank you so much for your time.
Thank you very much, Dr. Kvitko. It's a real pleasure to talk to you, and like I said, I look forward to and hope to meet you in person very, very soon.
And I'm looking forward to meeting you too. Yes, and you know what? I think I'm going to work on getting out there. I want to learn how to do this new technique. By the way, the kind that I do now, which is called connective tissue grafting, that was new about 20 years ago. And as soon as I learned about it, I went out and learned how to do it, and it's actually so much better. But it sounds like what Dr. Chao's come up with is a really cool thing, and that maybe we can improve the patient care that I'm delivering even more. All right, that's all the time I have today, folks. Don't forget to follow me on Twitter. It's at Dr. Kvitko, and visit my office Facebook page and like us. That's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588,